Hello and welcome to episode 8 of Healing Vibrations, changing the perception of illness to see it as a gift. And today my guest is Karen Sankey, who's a very interesting person who's got very similar beliefs to me, I believe. We'll soon find out in our conversation today about illness and how we can treat it and how we can help people moving forward. Karen Sankey is a wellness, health, inclusion consultant and coach. So welcome, Karen. Thank you so much for joining me. And tell us a bit about yourself and what you do.
Yeah, hi Gina. Thank you for inviting me today. So, essentially, I've been a GP for 27 years, and I guess naively went into medicine because I had this sort of desire to help people. And, it sounds very cheesy, but that was sort of the reasons for doing medicine. And I love science and love people. And I guess the longer I've done general practice, and particularly with changes over recent years, I've just discovered that the medical model doesn't really work for me and actually doesn't work for many of the patients. And so I've often sat in a 10-minute consultation with somebody thinking, crikey, what can I do? Just feeling that I'm letting them down because either I don't have enough time, I don't have the skills I need, or I can't access the support that I think somebody needs. So that sort of started me on this journey of, actually, I think we can do this differently. So in 2016, I left my job as a senior partner in a GP surgery to pursue, I guess, a sort of journey of exploring what actually would be the different, how would we do it differently, and looking at, I guess, what the current challenges and issues are and what we might do that might be more meaningful for people. And I'm particularly interested, I tend to work with people with sort of very extreme challenges and complexity. So I've done quite a lot of work with people who don't have a home, who are sleeping on the streets, people who are in prison or leaving prison, people with domestic violence victims, so people who've had real struggles and challenges. And that's where I've had focused a lot of my work over the last few years, and it's sort of taken me on this really fascinating journey, sort of personally and professionally, really, into where I currently am, which is doing some work strategically. So I'm doing some work with my local health board and feeding into some national work in Wales around how we perhaps start considering wellness as opposed to illness, and focus on that. And I've created a model called the community wellness model, which is a new way of working, which is very specifically targeted at perhaps communities of need. So that may be a geographical community of an area that perhaps has challenges because there's lots of deprivation, but also very targeted communities of need. So again, that could be homeless hostel or a prison and prison leavers. So that's sort of where I'm at. And then I also, part of the journey, I guess one of my big frustrations with the medical model is that we define people by their problems, and we like to give people labels, and then people are then carry that label, and that's how they're seen.
I have, yeah.
Yes. And that, for me, I just think we have a very blinkered approach in the current system, where we don't see all that skill and talent and the just wealth of incredible resource that people have. And I think there's so many people that are just overlooked because all we see is this label of their problem or their perceived problem. And certainly that became really obvious. I set up a homeless service in North Wales that I was involved in running for 3 years, and it really hit home to me that the people that are so overlooked by society as not seen to be any value at all to anybody, these people that are seen as useless and bad people, actually, as you get to know them and build relationships, you realize they have aspirations and goals and talents and dreams. And if you create the environment for them to have the headspace to sort of identify their passions and dreams and skills, and to sort of showcase that, really amazing stuff can happen. People can really progress. And so this is very much the nature of this community wellness model. It's very much about seeing the strengths and assets and gifts of people and not focusing on their perceived problem. And then part, I guess, of that then is it leads on to my next role, which is more around coaching. So what I sort of discovered, and again, my experience, I worked in a GP surgery that supports the homeless people, a dedicated surgery in England. And again, just found that handing out sick notes and prescriptions just wasn't helpful. It was just maintaining the status quo. So I've now trained as a coach, and I trained in art-based coaching. So very much using interactive methods of art and visual coaching for people to express themselves, perhaps people that feel uncomfortable, articulate, or unable to articulate what's going on for them.
Yeah.
And I'm also on the start of my journey training as a therapist as well. So I have this idea of offering almost blended wellness coaching.
So you've got your toolbox, and somebody comes in and you just decide what they need.
Yes.
Wow.
Yes. But also I think the big difference in the way that we work with the work we're currently doing is very much the people that have got that lived experience are the experts. And again, we have this model where somebody with a degree, like the GP, is seen as the expert, when actually the person with whatever their challenge they have is the expert. So our model is very much about the people with the expertise, those with the lived experience design the service, and we help facilitate that. So it's a very much a citizen-led offer and work, which is really quite powerful.
Because I think you said something in your bio that totally resonated with the idea, and you just sort of touched on it there, with the model, especially in the UK, but I think probably in a lot of Western cultures as well, we're taught not to listen to our bodies and not to take our needs as seriously. We're taught that if something's wrong, we go to the doctor, and the doctor gives us a pill, and the pill fixes it. And that's what happens. But of course, for one, the pills don't tend to really fix the problem. And for two, like you said, in a 10-minute consultation, with the best will in the world, you're not going to get to the crux of what could be the underlying issue of what is causing whatever problem they've come in with. And quite often and I'm sure you must have seen it, if somebody comes to you displaying a symptom, the symptom's just sort of the tip of the iceberg, really. What's actually causing it is like deep down, and from being a coach, and certainly if you go into therapy, that'll be, it takes a lot of digging. You're not just going to get that even from a 20-minute consultation. It takes some work and some, I suppose, effort from both parties, but they've got to be open. And I think what you're doing is even just trying to shift people's perceptions, I guess, which is what I'm trying to do with this podcast as well. Actually, because when you're ill, it means that you're imbalanced in some way. And the good news is that we have control over what we're in, what goes into our bodies, what goes onto our bodies, what we think about. We might not feel we're in control sometimes, but we actually are. And it's giving the power back to like you said, to the citizen, to the person, the patient, is at the crux of, they really know themselves better than any doctor or any nurse or anybody else.
I think you're right. And I think that there's two really, really sort of crucial points that you're raising there. I mean, one is, I think society has changed. We've created a system where people are now dependent on expert advising them on what to do, and people have lost their autonomy to self-care. And we use a term quite a lot of people, we've created a society of passive consumers, that people have to consume the service that is provided for them, or complain about it, or not engage. And we don't give people any choice, whereas actually we're trying to move people to be active contributors, where they actually have the skills and knowledge to make informed decisions for themselves. And I think we've lost some of that. I think certainly just in the years that I've been doing general practice, that the things that people present with now, sometimes are really quite almost trivial, quite self-limiting problems that people don't know how to manage them anymore. And I don't know whether that's a breakdown perhaps in communities or families, the dynamics, more people not having their extended family or people to get advice from. I'm not quite sure. I'm sure there's all sorts of factors, but we're definitely seeing that much more, that people sort of needing that expert opinion. And I think possibly general practice has shifted from, years ago, a lot of our work was about disease prevention and health promotion, and there's no time for that, no capacity in the system, because it's almost like the system is firefighting people, managing people who are ill. There's no time to do that upstream, preventing people and getting ill, and so I think that's one really valid point. And I think the other bit, like you say, is we very much, the system sees physical health and mental health as separate problems. We have separate directorates and departments running those, those two bits, and the social part isn't even included. So actually we're looking very much at a more holistic approach of what's going on for this person. And I guess the story I probably use a lot, the example is, somebody that's had a very traumatic childhood and has been exposed to abuse of some kind. We see this pattern all the time of people being let down by the system, that they've not had that nurturing, loving home environment. They go into school, and the consequence of the trauma is they have symptoms of trauma, which is often quite disruptive. It's displayed as quite disruptive behaviour, but they're labelled as the naughty child. Nobody actually tries to understand what's going on and why that child's behaving that way. So they get excluded from school. They then come and perhaps seek medical help, and we refer them into services, and they might actually, if they have any sort of behaviour like dependence or any extreme behaviour, they may actually get excluded from access to services in the first place. But if they do get through to services, they'll often get labelled with personality disorder. So you think this person has had at every point being told they're a problem, that by their home environment.
And therefore they are a problem, aren't they?
And then they're told that they're a personality disorder. So of course, they're, you treat somebody like that, what's their behaviour going to be like? And I think that makes me really sad that people often that display those either aggressive behaviours or toxic behaviour, there's always a backstory. And if you actually sit with somebody and actually get to understand what's happened in their life, there will always be some trauma there, always. Yeah. And actually, we don't look at that. We just see that, again, the label of violent patient or, ban this patient, and people, the most vulnerable people get excluded from the care that they need. Yeah, which for me is, and
it is. And I think also because we don't have, because I've got a friend who's in the, she's an occupational therapist dealing with mental health, but it got so much for her that she had to shift jobs a little bit, because she goes, the people that really need her help don't get the help until they're at the crux of, really, really bad, at which point, like you say, it's really hard to work because they haven't got the resources to spend the time and really get to the crux of it. So you're firefighting that person and just almost sort of keeping them just their head above water, which is not a nice place to be consistently, is it? And then of course practitioners actually get burnt out, because you've got that compassion fatigue, haven't you? That thing that people who want to care and want to go out there have only got so much capacity for themselves, and then it's like a knock-on effect. And again, I've got a friend who's in social work, and it's a similar thing, dealing with kids that are being put into the system, but there's not enough foster carers, there's not enough, there's not enough in the world of abundance that we live in. Then so it feels like we're talking our way to a real, this is really bad. So you've obviously shifted things up a bit and doing things. So can you see a brighter future?
I think for me, it's things that we don't always think about in the public sector that really can make a difference. And this is just sort of anecdotally the work that I've done with some really marginalised and vulnerable groups. And sometimes that creating a safe place. And so we often do our work out in community settings, in community centres, or we're currently doing a project in one of the churches in the high street. And I think taking away some of those barriers of a clinical setting and a formal setting, and just creating perhaps a more relaxed, informal setting that is more accessible for people, that can really make a difference. It can just really, you can engage people that don't traditionally engage with services, and just go more from having formal, I suppose, consultations to conversations. And I think people are more likely to open up. So I think that can really help, just starting to nurture relationships in a safe environment. I do question, whether the power of a good relationship can be more powerful than many of the interventions. And I think that's, again, so anecdotally, sort of the feeling I get that, and working with some of the really entrenched rough sleepers and street homeless, that just by, most of these people haven't been shown any love or care or been championed in their life, and actually by being shown some of that kindness and compassion and belief in them, we can get really big shifts in behaviour of suddenly people wanting. That's such a
big thing, isn't it? I did a very brief spell of working in a category A prison, working as an IT trainer in there. And I think some of these guys had never been told that they've done a good job. You know, even just something as simple as, you know, following an instruction and being praised was quite unique to them. And you just, you know, after being brought up in a nice family, I guess, that's, you know, that was supportive and kind and all that sort of thing, I sort of very much take it for granted. But some people have never had that, have they?
Yeah, and I guess that's part of the community wellness model. The first part for us is all about connection, and I think it's very much building on the Maslow's hierarchy of need, of sort of basic human needs, of creating safe places, building relationships, and letting people feel that they belong to something, because again, they don't belong anywhere. Society doesn't want them or like them or treat them particularly fair.
Yeah, well.
So again, I think we've seen some really dramatic shifts. So we run a volunteering program, so we create meaningful activities. So it's very much based on really understanding what people like doing and what they're good at, and actually creating opportunities for them to deliver that. So having people that have, I guess, again, moving people from being consumers to contributors. So people that actually have a need because they've got some issues, often quite complex issues, that actually if they then have an opportunity to have a role where they're contributing, they suddenly feel valued and valuable. And you see that shift of actually, oh, I matter and I belong and I'm important. And actually something really fundamentally does change then. And often then people are wanting to make further changes. So actually they might, if they have got a substance misuse problem, they may use substances less. And we see this quite a lot of, and that's part of the model of trying to draw people in to be part of delivering the service, and then potentially move on into possibly paid work in the future. So they're very much, you know, contributing and not seen as sort of a burden.
Yeah, and I think especially, you know, the whole idea of helping somebody else, because that is so, I don't know, powerful when you're not feeling in a good place, you know, and any time at all. If you then, I find it in being a coach as well, it's like if I go through a stage where I'm not coaching people, I start feeling a little bit lower, and I'm like, oh, what's going on? And then I'm like, oh, well, I haven't actually had any clients for the last few days, and that's why, because you get into a conversation and suddenly it comes away from my little problems that are going on in my world, but can feel very big, and go into somebody else's world and focusing on them, and that makes such a big difference. Yeah. I don't know if you find that as well.
Yes, exactly. And I think it's really powerful. I think when you're part of helping somebody else, I think it really gives you meaning, I think, and it's enabling people to do that. And we found when we ran the homeless service, we ran a drop-in service for the homeless in North Wales, and we actually had several of the people that attended had volunteering roles with us. So even some of the people that you would normally, I suppose, be completely overlooked, who were actually still sleeping on the streets and using substances, some of them actually had roles. So we had one of the chaps was in charge of time banking, so he looked after all the time credits, didn't lose a one, you know, and another one was in charge of the hepatitis service, so he would make sure that people would come in to have their hepatitis checks, and if they were due treatment, he'd make sure they came in. And it was really, really incredible, because on a Friday morning when we ran the service, they wouldn't have used drugs because they had a job to do and they were ready for
they
had a purpose.
That's quite interesting. So yeah, well, it is very interesting, isn't it? So the more purpose you give people, the less likely they are to because I guess why do any of us drink or smoke or do anything? It's usually relieve boredom, or relieve boredom's a big piece, isn't it? And if you've got a big expanse of the whole day where you've got nothing going on, that can feel, and a whole night as well, that could feel vast, can't it?
And I think for many people who find themselves on the streets, often they say if there is a history of trauma, they'll use substances to try and block that out. You know, most of them will have PTSD of some sort, and so it'll be to block out what's gone on in their life and the emotional distress of that. And again, I think we talk about this quite a lot in the service that we're doing, is actually it's about showing people that there's something, a different way to live that is more fulfilling than taking substances, but they've got to realize that, right, I can't tell them that. And I think that's part of what we do by giving these opportunities. What we find then is some people then say, actually, I want to cut down on using my drugs, and they actually are driving it then, rather than me telling them you have to stop. You know, they're making the choices. And we've had some really fabulous success stories of people that we've worked with that have been on the streets that are now in accommodation and working, and some in paid employment, some in volunteering employment with other organisations, and got a few people mentoring who were previously on the streets. And it's just really, yeah, for me, it's been the most amazing thing I've done in my career. It's really been,
wow.
really, yeah. I mean,
so have you managed to get funding then to run these projects?
So we have the project, the original homeless project I did, we had very small amount of funding, and I did most of it as a volunteer, because it was really, I suppose, testing a concept of how we might work differently. But we had to sadly close the project when the COVID pandemic started. But at that point, we had 37 agencies all working together in Salvation Army Hall.
Wow.
We'd have about 60 or 70 people turning up who sort of had a need that, you know, so that was amazing. And then we just started a new project in the church, which is funded by our health board and the council. So we're piloting that there, and then we're due to start doing some sessions in the local homeless hostel, and then potentially into the prison as well. So trying to link everything up.
Wow, well done. And I wish we had more GPs like you. Not just in GPs in any way, shape or form, because I'm sure their job is not easy at all. But I do think that as I sort of learnt about dealing with, you know, with my MS, and I did my own research and learned about the mind body, and learnt about, you know, the importance of nutrition and all that sort of stuff, and what a difference it can make. It was and again, I don't know any than yourself. I've met a couple of GPs actually, but the whole idea of nutritional training doesn't take a big part of it, does it? And I know I did try to speak to my neurologist about the mind-body connection, and it sort of went on deaf ears a bit. And again, I'm not dissing my neurologist. He's a lovely bloke, and he's quite open to me doing all my crazy stuff, but he's not what I would like to see, or what I would like as a person, is to be able to say, actually, I don't want to take medication. I want to try different routes. Could we have a conversation about that, a real conversation? And even more so in our NHS world, rather than taking the £5,000 a week cost of the medication, I instead would like a chiropractor and a massage maybe, and a coach myself. But of course, that doesn't come under the NHS model yet, does it? So
I think there is a shift, and I think, you know, there is, so medical training has been very much a biological sort of model of disease, you know, diagnosis and medical intervention. And I think there's a real shift, and it does feel over recent years, there's certainly lots of the conversations I've been involved with, health boards are looking to move more to a wellness approach, and looking at sort of more that upstream, trying to sort of prevent illness rather than wait till people are in crisis and firefight. So I think there's definitely that shift. And also, I think there are a lot of GPs that would like to work differently, but sometimes when you're in the job, you have no headspace to even think differently.
Well, I can imagine.
It doesn't allow you to do anything any differently. And again, I think there's quite a movement of some of the networks I'm involved with. There's GPs that have either left completely the NHS to either pursue lifestyle medicine or coaching, or some that are still within the system there's definitely a movement around lifestyle medicine and wellness, and more of a recognition of the value of coaching, I think. So I think there's a definite shift. And also there's a couple of networks led by psychiatrists and psychotherapists around how we manage, I suppose, how we demedicalize mental illness, because actually a lot of what people have is a normal response to some
trauma.
And yet we like to put a label, and we like to treat it with a medication. And while there might be a place for that for some people, for a lot of people, there's, you know, it's probably not.
There's other ways, isn't there? There are other ways of dealing with it. Because I'm also working with a friend of mine who's been in the system for mental health issues. So, and she wants to create a non-for-profit. It's in the early stages, called Beyond Session 8. Okay. So you understand what I mean by that. So anybody who doesn't know, if you're fortunate enough to be able to get counselling or anything through the NHS, you get a session where you get 6 to 8 sessions usually, I believe. and then it starts working, you start feeling better, and then you tick a box, and then you're left to go. And so this is like a sort of a peer support system, a safe place to, it's not medical intervention or anything like that, but just like you say, it's that building of relationships, having a space where you can speak about your stuff without having to worry about being judged, or without having to fix anything either. I think sometimes it's just, we just need to offload. And often when we speak to our friends or family, we all try and we all want to fix things. Nobody likes to see somebody in pain or unhappy, but sometimes it's just enough just to talk.
Yeah.
And that can be really valuable. So to have that space.
Yeah. And that's certainly one of the work streams we're developing, is looking at how do we make wellness accessible for people with no money. So at the moment, it's fine if you can afford to, you could buy gym memberships and yoga and coaching, yes, and all the things that we know really are really beneficial to us. But actually, if you have no money, how do you access those things? Actually, at the moment, you can't. So we're trying to, looking at creating community coaches, so training people in, at the moment focusing on sort of more deprived communities. So we have people in the communities who've got those coaching skills. Wow. And then potentially then developing community sort of, I suppose, therapeutic offers in community. So it just makes it really accessible, and you're not sat on a waiting list. Certainly in this area, we had waiting lists for psychotherapy was 4 to 5 years. Wow. And yeah, you know, it's quite a long time to wait if you're really struggling, isn't it? So how do we put some of those interventions out into community offers that people can access? So that's some of the work we're looking to develop. Oh wow, that's incredible. And when you think about the fundamental coaching skills as well that we learn, most of it is really simple, isn't it? It's like listening, you know, really listening, learning to listen, you know. And if we could teach that in schools, yeah, that would be a whole different way of being. And it doesn't have to be, you don't have to have big qualifications or spend years studying in order to become a good listener and to care about somebody else. And also, I think to leave your own judgments at the door, that's another valuable piece of being a coach and being a therapist or anybody, isn't it? Because sometimes we think we know the answers to other people's problems, but yeah, we don't. Yeah, what a kind society we'd have if everybody had some basic coaching. Yeah, we're actually that became part of our curriculum. And one of the things that I've got a lot of soapboxes that I like to get on, and one of them is the education system, because I think now in the wonderful world of Google and the internet, it's almost like we don't need to be told what history to learn, and what bits of geography to learn. It's about asking the right questions. And I think really, if we could teach our children the real fundamentals of what it is to be a human, then our society would benefit. Yeah, definitely. It's good to hear that you think there's a bit of a shift up. And actually, when you were talking, I don't know many GPs, but one of the GPs I've met was actually on a coaching program that I was doing, learning coaching. So, and she wasn't planning to, as far as I know, leave her GP surgery. So it's definitely something that she's taken upon herself to because she knows it'll be a benefit. So, which is good. Yeah, I think there's definitely an awareness now within public sector of the value of, I think those key things really about wellness, about lifestyle medicine and coaching, and the value of those. So that there's certainly projects and pilots popping up across the UK, and social prescribing is the other, which is sort of directing people to a community offering, a non-medical sort of offering, which in some ways is a shame that we need that, because actually the ideal is that you just access it in your community rather than going to your GP first to be sent back out to a community offering. However, I think with time that might be something that I think some people feel that they have nowhere else to go, so they go to their GP, whereas perhaps if as social prescribing takes off, and then I guess there's more of an awareness of what's going on, and you're actually what you can do. Because it was interesting what you were saying earlier about people coming to the GP with issues that aren't really about them necessarily being ill. It's about them not feeling good.
But I think, you know, if you imagine back in the day, maybe when our parents were young, then the GP, the doctor was that hub of the community, wasn't he? The doctor, the he or her, would have probably, you know, been part of bringing a child into the world, and all the bits in between, and when they've broken their arms and legs and all that, and know their history without necessarily having to look at big databases and records and stuff. And of course, that's all changed now. And it was very much, and it feels like an in out. I mean, anybody who's ever tried to get a, you know, a GP appointment will know how frustrating it is, and especially now, I think, post or coming out of the COVID situation, I don't think it's any better. I don't really visit doctors if I can help it now, but it's yeah, you could quite often be on the phone for a good half an hour just to get an appointment.
I think it goes back to this sort of thinking that we've disempowered society, really, that the things that people present with now that 15, 20 years ago, you never go to a GP with. So very, you know, minor illness, self-limiting things, lots of social problems. We get lots of people who have got housing issues or employment issues, or, you know, finance issues or relationship issues, come to the GP. And so I think, despite the fact there's lots of resources out there, I think people don't always know where to go and what's available. And so the default is almost, I'll go and see the GP.
Yeah, this is it for one of somebody to help. Yeah.
And I think the system is so overwhelmed and overloaded with, you know, and if we took out some of the demand that could be perhaps better addressed somewhere else. For example, the work we're doing, we're trying to almost encourage people to come to a community offering that keeps them away from the GP, so that those people that are unwell and actually need medical advice can actually get the access that they need.
Wow, that's now because I'm also involved in a bit of a community project. I'm in Rugby in Warwickshire, and we've just got some funding to help the unemployed get back into work, and I work from a local community centre. But I've found the most challenging thing is to find people to help. So once I get people through the door, then, you know, we can use coaching, we can use training, we can use support, and, you know, our success rate is pretty incredible. But the actual getting people to help, have you found that's a problem, or have you now built such a big sort of hub, people know about you in your area already?
With the project we're doing at the moment, it's quite early days, but I think this goes back to the engagement. I think the engagement is really difficult, and it's the bit that's often overlooked in traditional service models. And we talk all the time about the carrots. What is it you need to do to get people through the door? And for us, the carrots is food and a safe place. So we offer a sort of free food and come along and chat, and that's how we get people in. And then once they're in, we then try and explore what's going on for them and how we can best support them. Are you linked in with any of the social prescribing?
Yes, we have got a social. Yeah, I mean, I am linked into quite a lot. We do local networking things with all the you know, all the different organisations that are out there trying to help people. So it's just getting out and making those connections, isn't it, and keeping the connections.
Yeah, but I do think that's what's worked for us, has been working out what the carrot is, what gets people through the door, and if people are lonely or bored or, you know, or struggling, what gets them through the door, and it needs to be something that's non-threatening. So actually for us, just advertising, come along and have a chat, and, you know, we hand out free drinks cards, come in and have a drink, and then we do a lunch, people cook together and eat lunch together. So just that whole social, that's the bit we do first.
We have been talking about doing the lunch thing, so maybe we need to move that up the agenda a little bit and get people coming in, because and it feels like, because you were talking about the pockets of society that people sort of overlook, but if you think of us as a, you know, the human race, with that whole idea of, like, you know, raising the tide and everyone raises, it's like, you know, if we can get to the people that feel the lowest of the low and actually raise them up, then it feels like automatically everybody else will sort of raise up. It's just a nicer place to live, you know. You imagine going into a city and not having people begging because they haven't got you know, they haven't got a roof over their head and they haven't got any food to eat and all this sort of stuff that we sort of, you know, most people try and ignore and sort of walk past because it doesn't make us feel comfortable, because it isn't. It's horrible, you know. It's not comfortable, is it? It's not a nice thing at all.
And I think with our model, it's very much a whole community approach. So what we do, although we very much focus on people that have probably got the most need and the most complexity, it's very much a whole community response. And so we were actually talking about some of the case studies, and actually you know, we all have needs, and we all have times where, you know, those needs sort of escalate. And so actually there's something for everybody. So one of our volunteers who comes along and helps with our data collection and helps with cooking, lost his wife. He's in his 50s and he's looking for some meaning and purpose, and he was bored. And, you know, I guess my needs met because I wanted to do really meaningful work, and now I am. So actually, if you look across the spectrum of everybody that's involved, we've got some people who, well, people are there for all different reasons, but some people who perhaps are lonely, some people that are a bit bored, some people that are really struggling and, you know, and don't know where to go. So we have this very inclusive environment, and we have a whole diverse group of people turning up. And
it's really good, isn't it? Because I think when you get a diverse crew, it then, well, it just opens your eyes a little bit, because we, you know, with the best will in the world, if we've not experienced something, you haven't got a clue, have you? You don't know. And I think because I said to you, I've got MS, and my physical ability is waning somewhat, but this is like opened my eyes massively, because obviously I knew people were in wheelchairs and I knew people couldn't walk very well, but actually experiencing it and seeing it sort of slap bang in your face is a whole different thing, really. And I think that's the same with any situation. Until you actually know somebody or have experienced it yourself, we do take most things for granted, don't we? Because we do, because we're human beings. And
it's interesting, Lucy, who I work with on the project, is a social worker, so she runs it with me, and she talks all the time about monocropping society, that we like to give people their labels and stick them all together. So, but then you think, well, if everybody in a wheelchair is put together in a group, you have 10 people in a wheelchair, you need then 10 carers to look after the people in the wheelchairs. And actually, by just mixing everybody up, having this really diverse group, you get these reciprocal relationships. So we have lots of people where we have one lady that's got a learning disability who has befriended somebody who's got quite severe mental health problems, and they just help each other out. One of them was struggling with public transport and the other was very confident with public transport, so they now travel together. And, you know, you just start creating, you know, then if you've got one person in a wheelchair in that environment, somebody will help them out. You don't need official sort of carer as such, potentially.
No, that's it, because if we become friends, and it doesn't matter, you might not be able to walk, but I can speak and I can listen, and I can, I've got experience, and everyone's got life experiences, haven't they? And I think it's being able to take those life experiences and make them valuable. Is really, because when we do work with helping people get into employment, you know, one of the things is, you know, creating a CV that works. And so many people say, well, I haven't really got any skills, so I don't really do anything. So we're like, okay, well, let's go back and see what you've actually done then. And so you did this, then, oh, you did that. And it's like, oh, is that really me? It's like, yeah, that's really you. That's really you on that CV, who's doing all that stuff. And you just don't think about it, because I think sometimes if we find things easy and we just do them without thinking about them, we don't think, oh, that's a talent or that's a skill or nobody else can do that. We just sort of presume that, well, if I can do it, everyone can do it. But
I think it goes back to everybody having skills and talents and gifts, and I think it's actually identifying those, and that's very much what we do. We run a discovery sort of workshop as part of our session, where we try and explore with people what they like doing, or, you know, what did you like doing as a child, and try and find what they're passionate about, and then actually how could they use that. And it's really interesting, some of the things we've got a lady that came in who wanted to help, and she loves washing up, absolutely loves it. She's out of the kitchen, so she's now she's in the kitchen tidying up after everybody, and she absolutely loves it. And we've just done her kitchen hygiene course, so she's been accredited for that. So what we're trying to do is sort of match people up to something they like doing, and then give them, if they want, some qualifications sort of behind that, to actually take them on a journey. And there's a lovely story. There's one of the a young boy who is 16, who's got some he's neurodiverse and basically hasn't attended school for a long time. I think about 18 months. And he was actually allocated to Lucy, the social worker I work with, was allocated to, they have an outdoor space where they do work, and he was allocated to do some digging. And when Lucy spoke to him and said, what do you like doing? He said, I really hate digging, but I love numbers and I love tech. And long story short, he's been on this journey. So he now is training. He's done all his QuickBooks training, and he now works with the treasurer of the organisation and does all the accounts for him. He's been mentored by the treasurer. And he's just, we're just training up now to do part of our data collection. So, you know, he's now doing something he really loves, and potentially if we're successful with a grant we've just gone in, we'll be able to pay him to do that work. So he's moved from being completely excluded from school to actually being on this journey of now he's got some qualifications, and actually potentially he's going to get some paid work doing something that he really loves.
Yeah, and he's really good at, and you know, and let's face it, not many people really like the figures and all that sort of stuff, do they? So it's really a nice niche thing that he's doing.
Yeah,
cool.
So,
brilliant. I mean, you mentioned earlier, you said something about the system being, you know, you've got the physical and the mental and the social, all different sort of, instead of the holistic, the whole sort of person. You didn't mention spiritual. Does spirituality come into any of your stuff at all?
Completely. In fact, that's our strap line. It's about we feel it's everybody's right to, regardless of their circumstances, to be well, emotionally, psychologically, physically, and spiritually. That's actually the strap line we use.
Oh, cool. I'm glad we pulled that one back in there.
Yeah. So we do a lot we do some workshops and sessions around finding meaning and purpose, and what gives you joy, and we then co-produce different sessions. And we use a lot of creativity. We have a creation station running every week where we have different sort of creatives coming in doing activities just to really sort of help people find their creativity. And then we have different groups, sort of a wild tribe who do the nature group, and all sorts of different activities. So
you've really got loads going on. Whereabouts are you based?
In North Wales.
Oh, lovely.
Yeah.
Definitely a bit of an inspiration, thinking about maybe what we could do here in Rugby to sort of develop more of a community hub. I must say I think we were just making inroads. Of course, then COVID happened, and as it did. But here we are coming out the other side of it. So hopefully that will improve. But it's definitely given me, you know, food for thought. So if anybody was living in North Wales then and wanted to access, you know, some of the work that you do, how would they go about doing that?
Well, we're actually, the pilots we're running at the moment are in Flintshire, and so we're running in Shotton, is one of the towns in Flintshire. So that's where we're currently running our project, which is a pilot. We're actually in conversation with Bevan Commission, who are the think tank for innovation in Wales, looking at whether this could be a model that could be rolled out. So that if we're successful with a bid that we've put in, we're potentially going to be looking at developing an implementation pack of actually this is the learning,
how to do it.
Yeah, recognizing that it will be bespoke everywhere, because obviously every place is different and the needs are different, although there are some overarching themes, but actually just some of the core learnings and principles and perhaps training that might be helpful. So that's what we're doing. And then I'm very happy for you to share my email address if anybody wanted to get in touch. I'm on LinkedIn as well. I'm not very good at social media, unfortunately, but I am around.
So if could you give us your email address, then I can put that in any links that we
Karen at kswellness
.co.uk, and I'll put that in the links on the social media when we share this. So do you do any, because one of the things that I like to end this broadcast with is a brief meditation. So is this meditation, is that something you teach your people in any way?
So one of the therapists teaches meditation, and I use mindfulness and breath work in my coaching. So as part of the art-based method that we use, is we actually do start it with some mindfulness to actually get people in a really relaxed state to be able to do that piece of work. So yeah.
So would you be happy to share maybe one of those exercises with our audience sort of now? Would that work?
Ooh. It's quite a long one, actually.
Oh, is it? How long is it?
Well, I could do, let me just think, I could do one of that. I'd have to get my script.
Okay, cool. Is that okay? Sorry, I've dropped you. I've thrown you into the deep end a little bit, but
yeah, it's only because I've literally just moved off. This is not normally where I work, and so I haven't actually got all my stuff with me, my coaching stuff. Oh, I could, yeah, I could probably do something. So let's have it. See if I can find one of the ones.
Okay, well, I'll let you have it. I'll let you have a look for that, and I'll just say to everyone, thank you so much for listening for this week's podcast. And I don't know about you, but I certainly feel that Karen's doing some incredible work, and I'm so pleased to have connected with her, because we share a lot of the beliefs around how we can change perception of illness, and how actually we do have control over ourselves more than we think. And maybe the GP is not the best place to go. Maybe if you're struggling in any way, it's worth looking into your community to see if there's other projects similar to what Karen's doing that actually can help out. It's worth going to your local community centres, where churches might be a good place to go visit. Where else might people visit if they're just looking for support or community?
And I think certainly Googling social prescribing in your area, I think most areas now in the UK will have some sort of social prescribing network of actually a resource. In Wales, we have something called Dewis, which is a national platform that lists what's available in your community. And I think most places have something equivalent.
Okay, cool. Yeah, that's really good.
And actually, your GP receptionist may know, so it may actually be you don't need to see the GP. If you've got a medical problem and you're ill, that, you know, of course you need to see a GP. But actually, if you perhaps don't quite know what it is you need, you know, it may be just asking, is there a social prescribing resource? Have you got a list of what's on offer?
Yeah, and the GP receptionist might well be able to signpost you in different directions as well, because they, like you say, they probably get a lot of people coming to their doors.
And certainly in lots of places now, they have link workers or community connectors. There's this role that is evolving, which is very much doing that, is the person that knows what's going on in the community and connecting people into it. So they might be called something different, but that seems to be something that's happening again across the UK.
Cool. Okay, that's really helpful. Thank you. Right, are you ready to throw it at the deep end and to give us a nice little mindful exercise?
Yes, I've got a short mindfulness practice which I use in one of my coaching, sort of my art-based sessions. So, okay, so this is about if you can get comfortable in your chair and just bring attention into your body. So you can close your eyes if that's comfortable for you, or just have a soft gaze. Notice your body seated, wherever you're seated, feeling the weight of your body on the chair, on the floor. Take a few deep breaths. As you take a deep breath, bring in more oxygen, enlivening the body. And as you exhale, have a sense of relaxing more deeply. You can notice your feet on the chair, on the floor. Notice the sensations of your feet touching the floor, the weight and pressure, vibration, heat. You can notice your legs against the chair, pressure, pulsing, heaviness, lightness. Notice your back against the chair. Bring your attention into your stomach area. If your stomach is tense or tight, let it soften. Take a breath. Notice your hands. Are your hands tense or tight? See if you can allow them to soften. Notice your arms. Feel any sensation in your arms and let your shoulders be soft. Notice your neck and throat. Let them be soft. Relax. Soften your jaw. Let your face and facial muscles be soft. Then notice your whole body present. Take one more breath. Be aware of your whole body as best as you can. Take a breath, and then when you're ready, you can open your eyes.
I thank you. And I mean, what did that take? Probably only about 2 minutes, didn't it? And it's amazing that just by doing that sort of body scan, and it's quite nice when you've got somebody guiding you through, because then you're focusing on your voice as opposed to thinking, I've got the shopping to do, I need to do the washing up, or whatever else gets coming into your head. But even just that simple process of doing it yourself and consciously doing a scan and noticing how you're feeling, and also I think sometimes if you're just quiet for just a few seconds and take some breaths and just notice, where's your body calling you, you know, where have you got like tightness, where have you got that, yeah, and especially around the stomach area. I like the fact that you brought attention to that, because I think we do hold anxiety and tensions and worries in our stomach, which of course then stops us digesting and breathing properly and all that sort of stuff.
I often find that body scan or something similar is quite helpful if I can't sleep. So I think I'm at that age where sleep is quite disturbed, and sometimes then you become really hyperactive with your mind, thinking about all sorts of things. So sometimes just trying to do that body scan of focusing on different parts of the body can be quite a good way to get back to sleep.
Yeah, yes, yeah, thank you. And also consciously relaxing, because I find particularly in my thigh muscles, I don't know if you get it, but it's like, even when I feel relaxed, it's like when I consciously relax, I can feel them, oh, I wasn't really relaxed, I was still tense. So well, thank you so much, Karen, and thank you so much for sharing with us that mindful exercise. And I'm sure everybody, that's something anybody can do at any time. And there's lots of guided meditations and things on YouTube these days as well that people can listen to, isn't there? So I will leave it there. But anybody that wants to know more about Karen, she is on LinkedIn, or just get in touch with me and I can give you her email address, and I will share her email address. So thanks for all the great work you're doing, and thanks for sharing it with us, because it's really been inspiring to know that people like you are out there and making changes in the world. That's really cool. Thank you.